Welcome to The Explainer. Today we are going to tackle a problem that, let's be honest, hits a lot of us right after 40. It's that frustrating feeling where your muscles feel strong, but your joints, well, they seem to be singing a very different and much achier tune. So let's dive into the real science behind this frustrating mismatch.
So picture this. You're in the gym, you're feeling good, you're actually getting stronger, adding weight to the bar, but man, your shoulder has that nagging ache. Or your knee feels super stiff in the morning. Maybe your back just feels delicate. Look, this is not in your head. It's a real biological thing that's happening, a fundamental disconnect that can lead to some serious injuries if you don't understand what's actually going on under the skin.
And believe it or not, this thing has a name, the tissue adaptation mismatch. Now, I know it sounds a little technical, but the idea is actually pretty simple. Different parts of your body get stronger on completely different timelines. And getting your head around this concept, well, that is the absolute key to training smart, dodging those nagging injuries, and honestly, just staying active for the long haul.
So here's the crucial point. Your body isn't some single machine that gets stronger all at once. Nope. It's more like a team of different specialists. And some of them, well, they work a heck of a lot slower than others. And this difference in speed, this gap, that's where the danger really lies.
Okay, so what's really fascinating here is the simple but profound difference between what we call red and white tissue. Your muscles, that's red tissue. They are just flooded with blood, which means they get tons of oxygen, tons of nutrients. This gives them a really high metabolic rate, so they can repair and grow strong super quickly. But your tendons and ligaments, that's white tissue. They have very limited blood flow. Scientists call it hypovascular, and a much lower metabolic rate. Think of them as the slow, steady, methodical workers of your body.
And just how much slower are we talking about here? Well, the metabolism of your tendons and your ligaments is nearly 10 times slower than your muscle tissue. 10 times! That is a massive difference, and it is right at the heart of this entire mismatch we're talking about.
And this slide right here, this just perfectly illustrates the real-world impact of that 10x difference. You can start a brand new workout program and your muscles, they'll feel noticeably stronger, more adapted, in just 3 to 4 weeks. But your tendons? Oh, they need 3 to 4 months, or maybe even longer, of consistent, proper work to actually thicken up and get strong enough to handle all that new muscle power.
And then there's cartilage. Man, cartilage is in a whole league of its own. It has zero direct blood supply, none. It survives on what's called a pumping action. So when you move your joint, you squeeze the cartilage, pushing out all the waste products. When you release it, it soaks up nutrient-rich fluid, kind of like a sponge. And this means, well, it means without consistent, appropriate movement, your cartilage literally begins to starve.
So how does this biological speed gap turn into a hidden trap for us? Well, those exciting, fast strength gains you feel when you start out, they can actually be a smokescreen, hiding a much higher risk of injury.
You see, when you first start training again, that immediate jump in strength you feel, it's not because your muscles have actually grown bigger. Not yet. It's because your nervous system has just gotten way more efficient at firing the muscle fibers you already have. Your brain just got better at its job. But this creates a really dangerous illusion. Your powerful muscle is now yanking on a tendon. That's the cable that is still stuck way back on that 3 to 4 month adaptation timeline. This is the high-risk zone for what we call cumulative microtrauma. Just think of it as tiny little bits of damage that you don't even notice, adding up over time, until one day something gives.
And this is exactly why injuries after 40 aren't just random bad luck. No way. They follow very predictable patterns. Take your shoulders, for instance. They were designed to hang and pull, not press really heavy loads over your head. In your knees, cartilage has no nerves, so damage can just build up silently for years until you hit a tipping point. And after 40, the ligaments in your lower back naturally start losing some of their elasticity, which just makes them more vulnerable.
And to top it all off, this whole process is accelerated by natural hormonal shifts. For men, a steady annual decline in testosterone after 40, just like you see here, is totally normal. But this isn't just some number on a lab report. It has a direct impact. You see, testosterone plays a huge role in producing high-quality collagen, which is the very protein that makes your tendons and ligaments strong. So, less testosterone means, well, it means your body just isn't building the most robust cables anymore.
Okay, so I know that might sound a little grim, but here is the good news. This is the really important part. It's so critical to separate what's just an inevitable part of the aging clock from what is a direct result of your lifestyle, because you can absolutely control your lifestyle.
So on the inevitable side, look, the core of your tendons was pretty much set in stone by the time you were 17. That's just a fact. And the number of repair cells in those tissues can drop by up to 70% as you age. That's the clock. But look at the reversible side. Joint stiffening, brittle collagen, so much of that is driven by things like our diet, especially high blood sugar. And that is something you have direct influence over.
And a huge one of these lifestyle factors is something called advanced glycation end products, or AGEs for short. Now, when you have chronically high blood sugar, these sticky little proteins form, and they literally gum up your collagen fibers. This sugar stiffening makes your tendons and ligaments less flexible and way more brittle, almost like old plastic, which makes them much more likely to snap when you put them under load.
Okay, so let's put all this knowledge into action. It's time to forget the old rules of training you followed in your 20s. If you want to build a durable, resilient body after 40, you need a whole new playbook.
To stay in the game, you've got to adopt these 3 powerful mental models. First, always think red versus white. Remember, your muscles are ready in weeks, your joints need months. Second, see injury as a math problem. It happens when the load you apply is simply greater than your tissue's capacity to handle it. It's not bad luck. And third, and this is a big one, use the 24-hour response. The true sign that you overdid it isn't the pain during the workout. It's the stiffness and soreness you feel the next morning. That's your real report card.
So what does this actually look like in practice? Well, your priorities just have to shift. Right now, your main focus should be on building up tendon stiffness with heavy, slow, controlled movements. You have to manage your blood sugar to stop that sugar stiffening, and you need consistent daily movement to feed your cartilage. And what can wait? High-impact explosive movements and training to absolute muscle failure. All that does is increase the risk of your powerful engine overpowering its cables.
And this means we have to actively avoid some really common traps. First step, the weekend warrior spike. You know, going from 0 to 100 in a game of football or cricket, that is just a recipe for a tendon injury. Second, you've got to stop training for the burn. High-rep fatigue work does not give your aging tendons the slow, heavy load they actually need to get stronger. And finally, stop ignoring morning stiffness. If a joint hurts when you get out of bed, you overloaded it the day before, even if it warmed up and felt fine later on.
Okay, look, if you remember just one single thing from this entire explainer, I want it to be this simple but incredibly powerful analogy.
This analogy just nails the entire concept. You can tune up your engine, your muscles, very, very quickly. But the cables connecting that engine to the wheels, those are your tendons, they need much more time to be reinforced. And if you floor the accelerator with a super powerful engine but you still have weak cables, well, something is going to snap. The goal is to strengthen the cables first with slow, heavy, patient work.
So that's the question. That is the question you need to start asking yourself every single time you train. Are you just tuning your engine, just chasing more power? Or are you taking the time to reinforce the entire chassis, the tendons, the ligaments, the cartilage, to make sure your body is truly ready for the long, active, and powerful road ahead?